We're really delighted tonight to have Dr. Susan Nelson with us. Dr. Nelson is a clinical associate professor in our community practice in our veterinary teaching hospital. So what that means is that she takes care of patients every single day. In fact, she takes care of my dog. And so I've been told that he bites. And so, but anyway, he's a Welsh Corgi. And so anyway, she has lots of experience. Not only is she a faculty member of College of Veterinary Medicine, but prior to that, she was in private practice. And she's a K-State graduate, so she has lots of experience working with animals, particularly in the community practice arena. So we're delighted that she's here, and she's going to talk to you a little bit about careers in K-State veterinary medicine, particularly as well on first aid. So as we think about the spring coming on, although it's hard to imagine spring right now with as cold as it is outside. In fact, this morning it sprinkled on me a little bit, and there was ice on my windshield of all days. I was thinking, no, this isn't supposed to happen today. But it's hard to think about that, but it isn't going to be long until our pets are going to be running around outside. Days are getting longer, and so it's really important to know what to do in case an accident does occur. So that's nice to tell you about some of those things that we need to think about. So we're delighted that you're
here. Thank you. And you know what's right. It's coming. The more they're outside, the more we need to know our first aid with them. So I know some of you are freshmen. Are you all freshmen or any other ages that are here?
I'm a senior.
You're a senior. Okay, so you're getting ready to make a decision where you want to go. All right. So make sure you have one of the handouts because this is crammed full of a lot of information, and it's just so you don't have to take so many notes because it's going to have to go pretty fast here. One thing I will say, though, is a lot of these things we're going to talk about with first aid, we actually use in practice as a veterinarian. I mean, controlling bleeding, things like that is the same whether we're in practice or out in the field. It's just that you have to be a little more innovative when you're not in the practice and find things you have around the house and things to use to maybe help you out. So first of all, what is first aid? What it is immediate care. It can be a person or an animal who's been injured or suddenly taken ill. So what's wrong with this dog? Can you tell what that is? It's presented to the practice that way, and we actually see this quite a bit. It's a fishing lure in its lip. So they smell the bait on the lures. They go out fishing with their owners, right? The owners take their dogs. They smell the bait. They snap up one of those lures. So we pull a lot of these out of the mouths. Okay, so you want to have a first aid kit. If you have pets at home, it's a good idea to at least have a very basic. I'm going to give you a list next with a lot of things. But you want to have some minimal things in there. Now, some of you, as you get a little older, might be active in animal response. And that's one thing I help out with, too, is we have the Kansas Animal Response Team and then a lot of local responses. So people who go out to help with animal rescues are going to have some sort of a first aid kit, a field pack that's smaller than a bigger one they might keep in their car. So you want it to be durable, water resistance if possible. A lot of times like tackle boxes work well for this. Easy to access, label properly, and make sure you can store it where you can find it. So if your pet does have an accident, you know where your supplies are. And that gets harder to remember the older you get. So, okay, and you have this list in your notes. But common things you're going to want are assorted bandage materials, some scissors to cut the bandages, maybe some hydrogen peroxide. And we're going to go through some of the more common emergencies we see and why some of these things are going to be used. And a couple other things, and there again, you might have some of these, the 2-liter bottles. What do you think you might have those in there? They'll be empty. Or a milk carton. What do you think? One. Not as much that. You can fill them up with hot water and then use them to help warm up animals who are cold if you find one who's chilled. And so we'll kind of deal with a few of these other ones too. Okay, so when you're assessing an emergency, you need to try to stay calm. So even though your heart might be doing that, you need to try to stay calm if possible. Now, some of these are happening out by a roadside. An animal gets hit by a car. You need to make sure traffic's controlled, the scene is safe first before you try to attempt to do anything with that animal. And you want to enlist help of anyone who's not doing like this, okay? Because they're going to be of no help to you. And then have someone call a vet or the local veterinary emergency center. And then at that point, then you'll start assessing that animal. And you're also going to take a quick survey and see what you have around, what's in your car, what's around that you can use. And this all gets done really in a fairly quick time. So the first thing you do is what's called a primary survey. And with this, you might have to perform what's called a safe rescue. So if that dog or cat is out on the road, you're going to have to pull them off the road and move them a little bit. It's best to approach them from behind. If you walk right in front of them, they see them already hurt and they're scared. It tends to freak them out more. And do remember this, injured animals are scared and they're going to bite you. So we have to be really, really careful when we're dealing with an injured animal. And so you may have to muzzle these guys. And these guys were really crazy animals, I'll tell you. So you may have to muzzle. And then the ones you don't want to, think about, this is a fancy word, meaning they have a short nose. So think of boxers, bulldogs, things like that. We don't want to muzzle them. They already have a hard enough time breathing. Or if they're actively vomiting, or even if they have a longer nose, but they look like they're having a hard time breathing, do not muzzle. You'll make it worse. What you might need to do is throw a big towel or a very thick blanket, something like that over them. If you think there's head or spinal injury, maybe sliding a coat under them or something where you can make a little stretcher to take them out on. We're going to talk later why you don't lift them up by the belly. And then at that point, after you've made your safe rescue and got them moved, you're going to give them the ABCs of assessment. So A is going to be for airway, B is going to be for breathing and for bleeding, and C is going to be for cardiovascular. So for the airway, if the animal's breathing, if you can tell they're breathing, don't attempt CPR. They're doing okay, all right? They're doing okay where they don't need CPR. So, but if they're not breathing, you need to extend that neck out just a little bit, pull the tongue forward, and you're going to check and see if there's anything that's obstructing them. You may need to, we'll show a picture here, sweep a finger, and this is going to be in unconscious animals, okay? Be careful if they're conscious because you might get bitten. But what we do want to do is what's called a finger sweep, and we want to avoid, there's little bones back in this area. They're kind of delicate, so we don't want to be jamming. We don't want to also be pushing things back further into the throat. And then if you do a finger sweep, you're not finding anything, watch and say, or if you do and you remove it, see if they start breathing. So this is kind of an example, the finger's there. This dog's actually white, but it's her own dog. It's a very good dog. But you're going to sweep back there and see if there's anything obstructing their breathing, if they are not breathing. Okay, so for rescue breathing, so let's say they aren't breathing. For small dogs and cats, you can hold their mouth tightly and you're going to blow right into their nostrils. I'll show some pictures here, about 10 breaths per minute. Bigger dogs, if you can, pull the tongue forward just so the tongue's not rolled in the back. And there again, most of the time these guys are unconscious, so you're not going to get bit at this point. And then you're going to hold their lips shut and blow to that nose again, about 10 breaths per minute. You can cut down a plastic pop or water bottle to use as a mask. So this is an example of rescue breathing. So the mouth is closed, your hands are cupped around it, and blowing right into the nose. If you're a little more squeamish, you can do this. So you can carry around, you can use a little pop bottle or something like this for smaller animals where we just cut off this top. Bigger animals, you might want to cut off the top of like a 2-liter bottle. So it's a little bigger, so you have a little face mask. You're going to breathe in here, the mask is going to be over there. One thing I would do if you cut these down, what you want to do to these edges is kind of take a flame and melt those a little bit so they're not sharp and so it doesn't cut them. Okay, so for rescue breathing, after you've given, let's say they're not breathing, if you've given 3 to 5 breaths, stop and check for breathing. If they start breathing, you're done. You may need to push down on the stomach frequently to get rid of air. This is a big gas distended stomach right here. This is the diaphragm running right there. So when this starts getting really big, full of air, it makes it harder, these are lungs that are here, to expand out and fill with air. So every once in a while you have to push down kind of on that rib cage area and right behind it to get some air out. Okay, C is for cardiovascular. So first thing you need to find out is if you're going to have to do chest compressions. If you can find a pulse, then you don't need to do chest compressions. And if they're breathing, their heart is probably beating too at that point in time. But if you do have to do chest compressions, you're going to lay them on their side, preferably the right side down, okay? So you want the left side up, you're going to lay them down the right side. And then if they're a little animal, you're just going to put your thumb and forefinger on either side of the chest, and you're going to squeeze to have that lid on tight. Or you put the palms on either side of their chest, and then you're going to pump that way for them. You're going to compress about 1/3 to the half the width of the chest. There's a possibility you can break ribs, just like with people, when this is done effectively. At least 100 compressions per minute. A lot of people say, who knows the Staying Alive song from Saturday Night Fever? Yeah, the moms do. You have to teach it to your kids. That's a good beat to think about doing that when you're doing your chest compressions. So otherwise, you press hard and you press fast. You want to really go as pretty quickly as you can. And then stop every once in a while, check for the heart. If it starts beating, you stop your chest compressions. Now, there again, on a larger dog, right side up, you might have to use both hands to do this. And you can compress about, there again, a third to half of the chest width. So it's a lot like the small animals. We're going to show some pictures here. Okay, so, I know this is black dog. It makes it a little bit harder to see, but her elbow's right here. And so where you're going to put your hand is on the lower half of the chest, right behind that elbow, typically. Here's another view. It's just, we're looking from this side here. We're looking from her back. Some people are going to take a fist and put a hand over and pump. Some just do their hands like this. So whatever works best for you. But you're going to try to compress that chest down about a third to half of the way, and as quickly as what you can. Okay, if you're on your own trying to do CPR to your pet or another animal that you find, you want to do more chest compressions than you do breathing. So you'll probably only do about 4 breaths per minute. So about every 30 compressions, you can stop and give them a couple breaths. But if you have someone to help you, you can go ahead and do your compressions. Now, when the person doing the breathing is ready to give a breath, the person doing the compressions has to stop momentarily so they can give a breath, and then just keep going ahead and do the chest compressions. So how long do you do this for? Some people will say about 10 minutes or until you're just too tired to go on anymore. So other things to think about. So this is some newer thoughts, is to actually check the cardiovascular system first and then do the airway. So we used to be taught ABCs. Really now they're saying CAB or CAB. So do your chest compressions, start doing some of those first if the heart isn't beating, and then you're going to check the airway. So that is the newer thinking at this point, is to do the chest compressions, then check the airway. And then if you have someone helping you, alternate compressors about every 2 minutes. So in our ICU unit, when they have what we call code 10, so something that's coming in cardio arrest, they're going to have students that they're doing chest compressions, so they're going to switch them about every couple of minutes. And the reason why, there's something called compression fatigue. Everybody's going to get tired, pumping hard. And if you don't switch out, your chest compressions are going to get less effective, and you aren't being as helpful to the animal at that point. So if you have someone to switch with, alternate every couple of minutes who's doing the compressions. Okay, B is also for bleeding. So we're going to talk about really bad external bleeding first. So there's different ways to control. One, you just can put direct pressure on that wound. You can put some soft bandage material or a washcloth or whatever you have right on the wound. And that's most preferable. And for a lot of wounds, that's going to work. So whatever you have that's absorbable that's around the house, it could be paper towels, it could be a cloth, an old t-shirt, whatever you have. And they avoid some of the squeamish, but even maxi pads, they're clean, they're sterile, they have a lot of absorption. You want to hold it on about 5 to 10 minutes or longer, and don't disturb the clot. If it starts bleeding through your material, you just add more onto the layer. Because what you're going to do, if you pull off that pad you had on there, you pull off the clot, and it starts bleeding all over again. So just keep adding layers onto there. And then if you're by yourself and you have to do other things to that animal, you may have to tie your whatever you have material on there in place so you can do whatever else you need to do with that animal. If you have someone to help you, or you can prop a coat under there, elevating the limb helps a little bit too. Let gravity help you out a little bit. Okay, so if the bleeding's bad enough there, you're putting direct pressure on, but you're still having bleeding, the next thing is we're going to put direct pressure to an artery. Okay, so you'll still want to do your direct pressure, but you're going to apply pressure to the arteries supplying that wound. So, I'll just click through all these. These are fancy words. So on the inside of the upper leg, on the inside of the forearms, a brachial artery, so you just put some pressure there. On the inside of the back leg is your femoral artery. You're going to put some pressure right on the inside of that leg. If the tail's bleeding, you're going to put it to the underside of that tail. So this is where some of the major arteries that supply those extremities are going to be. Okay, if you're still having a lot of pressure, you may have to bind whatever covering you have in place and put pressure above and below the wound. If that wound is spurting blood, like you see in the gory horror movies, that is arterial bleeding. But if it looks a little darker and it's not spurting, but it's just pooling, coming out and pooling, that's venous. And so if I have a cut here and it's pooling, I want to hold that actually below that wound to help hold off. If it's spurting, I'm going to hold above it to do that. That makes sense? Okay. Okay, things, especially if you get really into this, or let's say you do a lot of hiking or something with your pet, so they're maybe at high risk of getting cuts and lacerations. There are some products out there called Quick Clot and Pet Clot, and there's some other names for them. We'll show you a picture. They're made out of kaolin. They're like a lot of the military products that they take out to the field with them. So if there's a bad injury, you put these on there, you leave them. You don't remove them, you just leave them in there. So you apply it to the wound and you wrap it in place, and that will help a lot with the clotting. So these are just a couple of looks. Some of them come in kind of like a gauze packet, so just like a little gauze 4x4. They make these for people too, and they recommend people who do a lot of mountain climbing, things like that, keep some of them with them so they can use them on their own. But they make some. This is the human one. Pet Clot's just the same thing. They just put an animal name on it. All right, tourniquets. In general, tourniquets are a big no-no. You only put them on if the bleeding is life-threatening and you don't think you're going to save that leg or that tail, okay? So we're going to show some pictures here. Generally, you want a little bit wider piece of cloth. So like a tie or something would work for that you might have at home. You're going to tighten it by twisting a stick, a pencil, or whatever you have, and then you're going to tie it into place. You only leave it on for about, you want to loosen it for 15 to 20 seconds, about every 20 minutes or so. So I had my students be creative yesterday. I said, look around, see what we have that you can make a tourniquet without using like bandage material. They found one of our leashes, which is a little narrower than we probably want to use, and then they just found a little highlighter pin. So you first start by putting it on the underside of the leg, and then you're just going to tie it like a shoelace. You're going to do one throw over it. And then they actually found it easier. A lot of times they put the right here, they'll put the pin on top, but when they were messing around with this, they found it easier once they did that first throw to slide the pin under it, and then they started twisting. Now, this was a live animal. We didn't twist it very hard because she was a willing participant. We weren't going to put the tourniquet on her. So anyway, so this is for demo only, by the way. So, but it gets twisted, and then the leash was long enough they could just tie on top of that to keep it from unraveling and then twisting that way. So that's kind of a basic tourniquet. You can use it on animals or people, but like I said, these can do a lot of damage. And so a limb that maybe could have been spared, if this is used improperly, it can lose the limb. Okay, so internal bleeding is not as obvious as externally. You see blood, right? It's very obvious they're bleeding. It's not so obvious when we have internal bleeding, though. So what are you looking for? You're looking for very pale gums. You can check, usually people are going to check the gums. You can look at the inside of the eyes, and the lining will look a little white and pale. The limbs are usually going to feel very cool, so their paws, their ears, their tail are going to feel cool to the touch. And they could be overly excited, or they could be very subdued too. So you see the whole gamut. Oops. So it can be life-threatening. Like I said, it's not very obvious sometimes at first. So but let's say you came upon an animal who was hit by a car. Even if they are walking, don't allow them to continue to walk because they may be in shock. They could be internally bleeding. And the same goes for people. You know, a lot of people walk around in shock and have some major internal injuries going on. And then transfer for help as soon as you can. So shock ultimately needs professional help. And there are some things we're going to talk about that you can do. Instead of never assume they don't have it. And it can result from many things. So early stages of shock, and you know, I'm putting this up here just so you know they can look kind of different. So the heartbeat is going pretty fast during the early stages. Their pulse is very easy to find. Their mucous membranes usually look pretty pink. And they have usually pretty rapid, what we call capillary refill time. And we're going to go over capillary refill time in a moment. They could be excited or they could be quiet. So capillary refill time, what that means is we're going to lift the upper lip. And then you wait kind of for the, right when you lift that lip, the lip will kind of blanch a little bit, wait for the color to fill in, and then you're going to press a finger on there. And then next you're going to wait and you count and see how many times it takes for the color. And I know this is harder to demo, but this is getting a little, this is where it was blanched from the finger, a little less blanched, and now we're getting back to normal. You're counting how long it takes for that color to fill back into your blanched spot. It should be less than 2 seconds for a normal animal. Okay, intermediate stages of shock. These guys, it gets harder to find the pulse on them. Their heart rate's usually still elevated, but their gums can look kind of muddy, kind of bluish, kind of gray. Now their temperature is starting to drop. So they're going to have a lower temperature. They're usually depressed and weak. And then later stages of shock, now the hearts can be very erratic. It can be slower, it can be fast, but it's very, very erratic, and usually it starts slowing down. It begins to be pale, they can bluish or blotchy. So they're going from nice red still to now they look kind of what we call muddy, so grayish, bluish. The pulse is hard, weak, and hard to find. Breathing's kind of all over the place with these guys. Their temperature is definitely below normal at this point. And these are the ones that we say have like a glazed look. They just kind of look at you like they're looking through you a little bit. And then they may act depressed or comatose. So what can you do besides doing the first part, which you'll need to do? Remember your ABCs, so check cardiovascular, check the airway, check the breathing. We want to keep them warm. So if you have a jacket or a blanket, you're going to want to throw this over them. But no heating pads. Can anyone think why you probably don't want to use a heating pad on an animal in shock? Are they moving around very much a lot when you get to the severe shock stages? Usually not. So what do you think happens when you just lay them on a heating pad that might be turned up a little too high?
It might move.
It might move. Well, they could. Hopefully they will. So if it's really hot and it's really high and they can't move, what's it going to do to their skin? It's going to burn them. So we have to be really careful if you're going to use a heating pad. And then we want to keep them as quiet as you can. Don't give anything by mouth unless whatever veterinarian you're speaking with says to try to do that. So once you kind of made sure you've taken care of the CPR part, you can kind of start doing some other things. You can take a rectal temperature. I highly recommend not using a mercury thermometer, but sometimes that's all people have in the house. Because those have to stay in about 2 minutes. Try doing that to a cat. Doesn't work. You want the fastest digital thermometer that you can buy. Our students find that out really quickly when they try temping some cats. You want to lubricate it a little bit, and then normal temperature, and you have your ranges in that handout, 100.5 to 102.5. And then you should always kind of look at the stool. I know it's gross, but you shouldn't see any frank blood on it, or it shouldn't look blackish, and it shouldn't look like it has diarrhea. Okay, heart rate. We're going to show some pictures here. How do you try to find a heart rate or a pulse? So if you want to try to find a heart rate, if they're laying down, kind of like where we saw the chest compressions, you're just going to feel there on the chest. Otherwise, we're usually looking for the pulse on the inside of the thigh. And if you get really advanced into doing this, ideally, your heartbeat and your pulse match. They should be synchronous with each other. That gets a little advanced. What we want you guys to do is at least know where to find a heartbeat or find a pulse and just see if it's even beating. So there again, this dog's laying on its side. We've got a hand right behind the elbow. So right in that same place, you can feel for that heart. And then for the femoral pulse, we kind of showed you where that was for blood control. And you're going to go on the inside of the thigh. You can feel it. If they're laying like that, sometimes we just cup our hand around and we feel with our fingers on the inside of that thigh. And then we're going to feel for a pulse. It's easier to find these pulses on dogs than it is for cats. Cats can be a little trickier. They're not quite as easy to feel. Okay, pulse ranges. Cats beat a lot faster than dogs do. Small dogs beat faster than larger dogs do. And again, your chart has all these averages on there. So if you have your own pet at home, it's a good idea to start feeling, get used to finding these and kind of see what's normal for your pet. So if they do get sick, you know what abnormal feels like on them. And this is a fast cheating way. It's a little more accurate to count longer and multiply, like 15 seconds multiplied by 4. But really fast is you can count it for 6 seconds. Just add your 0. There's your heart rate or your respiration. So for respiration, usually you just kind of look for a rise or fall or lay a hand on their chest. The other thing you can do if you happen to have like some cotton, you can tear it till it's a little wisp and put it in front of the nostril to see if there's any air moving. Average is 20 to 40 breaths per minute. So if you have an animal at home who's at rest, not after playing or anything, that's breathing 60, 70 breaths per minute, that can indicate there could be a problem going on. Okay, so after your primary survey, if you have time, this may be something where it's at home. Maybe it's not a super traumatic thing going on. You assessed it, it didn't need CPR, so now you can do some of these other things. Okay, so generally you're going to look them over head to tail. You're going to look at their pulse, you're going to do their capillary refill time, take their temperature, and then apply some first aid if you need it. Now, so let's say they had some bleeding, you got it stopped, but you still need to get them into the vet or to the emergency center. You're going to have to get them there. And one thing you're going to want to do is you want to call ahead. just don't show up, because here's why. They might be closed. It's after hours. A lot of places, especially in the bigger cities, send their after hours emergencies to an emergency center. And so you always want to make sure that place is open before you go, or if they're on call, that they can meet you and they know you're coming. And then the other thing is, you don't want to hang up too soon, because you might be missing out on some valuable advice. So you might be panicked, you might hang up before you really need to, but make sure they're all the way done talking before you hang up on them. Okay, so if you need to lift these guys, for the dogs, what you want to avoid is lifting under the belly, because what that's going to do is, if they, let's say, been hit by a car or something, let's say their spleen or their liver is bleeding, so we have some major internal bleeding. If we pick them up by their belly, we put pressure on those organs and can make it worse. So what we want to do is scoop them, one hand under the chest, one under the rump, and we'll show you a picture here. For smaller cats or dogs, if they're unconscious, you can just slide. This is my cat or dog. I'm just going to slide my hands under, and you can just carry them like that. I'm not going to work if they're awake. We're going to try to jump off, maybe bite you, do something like that. But if they're unconscious, you can do that. A cat, if they're awake, but you need to get them somewhere, you may have to scruff them, but make sure you're supporting them with your arm. Did you have a question? Okay. So this bigger dog, now this is a dog we had at the clinic. You may ask why she had all this contraption on her. So let's do this part first, and I'll give you the why. So she's got a hand under her chest and then supporting the rump. Normally she'd probably have her hand come under here. We had taken a little lump off there, so she was avoiding our surgery site right there. This is a very nervous dog. Here's a classic. She wasn't hit by a car or anything. She was here for us to take some little lumps off of her. But she's a very scared, nervous dog. Muzzle, we got to put it on her. She's going to bite because she's scared. And then for her, this is called a calming cap. So basically, it's kind of like a little hood we put on them. And when they don't have that visual stimulation, it helps calm them a little bit more. So if you find something like out on the road, if you have a lightweight T-shirt or something, sometimes you can put that, just throw that over their eyes. Kind of like people blind horses sometimes, to kind of decrease that visual stimulation that might be upsetting them a little bit more. So she wasn't being tortured. This actually was better for her and safer for the students. It kind of looks bad, I know. So, and then for a cat, this is one of our blood donor cats. So he was volunteered to do that. But anyway, so just a light, you don't have to like manhandle them. You want a little bit scruffled so you have control of the head so you don't get hit, and then support. So usually you can just kind of squeeze them in with your elbow and kind of support that rump and that chest. Other things, sometimes people are going to bind them up in a towel. This one, they didn't need a muzzle, so they just used a tie and wrapped it around so the dog couldn't bite. Because remember, when they lift them up to move them, they may bite. And then this dog, they just left it on his dog bed and transported it in. So sometimes that's the easier way. Things like laundry baskets, things like that can be used too. So cardboard boxes, pillowcases. I've had cats come in pillowcases before. There again, a blanket or a board, if you think there's spinal injuries, to kind of keep them from being bent and flopped all over the place. There again, you can throw a blanket over the head to calm them down a little bit. Do make sure that if you have them in a carrier or something, that they're not going to slide or fall off the seat. Nothing worse than making a crazy turn and having the the carrier go off the car seat. You want to keep them warm, and then, like I said, drive it carefully, even though you're kind of going like this with your heart and your adrenaline's all amped up. Okay, so any questions on just the regular CPR or anything like that, or transporting these guys? This gives me time to take a drink. Okay, so we're going to talk about some common emergencies that we see. And so these are things we see quite a bit that come in that you can see and happen to your own pets. Because they come into us, they happen to someone's pet, right? Okay, so skin wounds, that can be a little abscess, which is an infection. Laceration is a fancy word for a cut, or a puncture wound, so that we see a lot from bite wounds, from dog bites, cat bites. So for an abscess is a pocket of pus that's in the skin. Think about it as an extra big pimple. And so you can do warm, so a compress is like you take a washcloth, use warm water to get it warm, and you can just lay it on there. That will help with some of the inflammation, sometimes help that abscess kind of come to your head so it ruptures and drains. And you can do that 3 or 4 times a day. But ultimately, except for the most minor ones that are in a good location for drainage, you usually have to have medical attention. Usually we have to sedate them, flush them out, get them on antibiotics. Lacerations, if it's more than just a little minor one, you usually need to get in, be seen as soon as possible, get them sutured up. but you want to get them covered and maybe put a bandage on if possible. Puncture wounds, the problem with puncture wounds, they look very, very innocent when you look at them, just see a little hole. They can do tremendous damage underneath the skin. And then they're very prone to forming abscesses. And so these, you don't ignore them, you should get them into the veterinarian for those. So for a minor laceration, you can't put these up like at Walgreens and things. This is for people. A lot of elderly people used to say we are blood thinners. They'll have these little packets, so if they get a scrape, they can just kind of pour that on for something minor. You could do that for the pets for a minor one. And these are kind of a one-time use only. There again, we're back to, you can use some of your pet clot or your quick clot. Now, if it is a major, it's bleeding, so you have a very deep cut on there, and there's a lot of bleeding, don't try to clean it up or anything. Your main goal is to stop the bleeding of those, okay? But if they're not bleeding, they're kind of minor, just minor, you can try to clean them up before you put a bandage on. And this is, there again, on an animal who's being compliant, not going to try to bite you, and we'll let you do this. You can't do this with all animals. You'll be in risk of getting bit. And I have spelling error. That should be wound. Okay, so you want to stop the bleeding first. And then here's when you're getting more advanced. If you have a little KY jelly, you put it in the wound. What happens if you have a big wound and you're clipping that, you put the KY jelly and then the hair from the clippers falls in there. And then when we wash it, it goes out with the KY jelly. But at home, you may not have that, so you want to clip, and then you just need to flush and flush with lots of water. You can buy like saline at Walmart, but at a minimum at home, you're just going to have to use some water to do that. And then you're going to pat it dry and apply an antibiotic ointment, such as like Neosporin or some triple antibiotic ointment, and those are on your list. So you want to have some assorted bandage telfas. I think most of you have probably had one of these on you at some point or another. These are the non-stick ones that we put on when someone pull it off. It's not sticking to you. You want something kind of absorbent to wrap around. This is just going to help hold it in place a little bit. So this is just called roll gauze. And then they make, this is called vet wrap in the veterinary world, but they make this for people too. You can find this at Walmart. This just sticks to itself. It doesn't stick to the wound at all. And I think you've all seen white athletic type tape too. Now, we're at the veterinary hospital. We have all these to our disposal. But you may not have all these things at home, right? So there again, you may be using just a paper towel and then binding it in place with something. And we'll show some of these that you can do. So for your bandage, if possible, start with a clean wound. You're going to put your non-stick telp on first, and an absorbent layer, and then an outer layer. So at home, you might have gauze pads, cloths, you know, things like that. Outer layer, the vet wrap, the adhesive tape. You need to be, I put a question mark by duct tape. You have to be very careful. That is not breathable and can lead to some problems. But it may be all you have at home to use. Masking tape might be something you'll have around, and you're going to put these things over something else. You don't want to put these directly on your wound. So, and then if you're doing a foot, let's say they have a bleeding foot, you're going to wrap from the toes on up first. And you're going to change your wraps if you have bleeding coming through. If it's that bad, by that point, you're probably going to be at a veterinarian anyway. But how often you change it can be anywhere to 1 to 24 hours. Because some of you are going to have pets that come home from the veterinarian. Maybe they had some trauma, and the vet's going to have you guys wrap these at home, or have your parents do it, either or. They keep them clean and dry for the next week or so. So when you're doing that, if you see any discoloration, any blood or anything seeping through, you may have to change it in just a couple hours, or if they've already really stopped bleeding, every 24 or maybe even every 48 hours. So this is our makeshift wound. And here's actually where we took a lump off of that dog yesterday. So we got wounds on the leg. So we're going to do first, let's put some telfa, just lay it over there. It's going to be hopefully sterile, not infect. Then we're going to cover it with something soft, whatever you can find at home. It could even just be a t-shirt. You may not even have a telfa, that's okay. Then you just put your t-shirt on there. And then we're going to wrap it with something to go around to kind of protect it a little bit. And then we've got our finished bandage. Now, this one, we were trying to do it without having to tape it, and she actually needed this wrap to protect her wound. We ended up having to put some sticky wrap right up here because it wanted to slide kind of right off of the wrist there. For a foot, depending, a lot of times what dogs do is they cut their pad, and so you'll have to wrap them because they have cuts on the underside of their feet. If possible, you want to leave the middle two toes exposed so you can watch for swelling. When the foot starts to swell, those toes badly start to spread apart, which is a sign that you need to get the bandage up right away. So usually we just start with our soft wrap, and we wrap upwards with that. And so just a little booty that's on their foot. So they can be pretty basic wraps. It's really no different than how you're going to wrap yourself. You need to be careful you're not getting these pulled too tight. Otherwise they act as a tourniquet and we can have some problems. I'm going to show a very graphic photos pretty soon of some bandages gone wrong, okay? Courtesy of one of our orthopedic surgeons. And we'll get to that in a moment. But, so when you put something on their feet, what do dogs want to do? They want to eat them and take them off, right? Well, that can lead to more problems because they can get obstructed with it. So you need to usually try to keep them away from the bandage. So you have the traditional cone of shame, called an Elizabethan collar, that's called the cone of shame. But you don't always have one of these laying around at home. So you can take a big beach towel or something, fold it up, and then just here you could use duct tape and just tape it around and basically make a big collar around it so it's harder for them to turn around and to get the things. Okay, fractures. So you may think or you may know actually that your animal has a fracture. These guys are incredibly painful. I guarantee you they're going to bite you if you try to touch that. If that animal is unconscious and it's an open fracture, meaning you see bones sticking out, just try to cover it with something moist to keep it moist and you're going to get them in. If they're unconscious, sometimes you can apply a splint. We'll show you that. Probably not one that's open, just get it covered and get them to the veterinarian. And the splint is to temporarily immobilize only. You guys are not attempting to set a leg or anything. You want to get them to the vet. So a makeshift, let's say you're not sure if it's broken, it's not open, but they're favoring it. For a front leg, you can use newspaper, magazines, sticks, cardboards. You apply it to the side or the back of the leg. Let's say you think there might be a break right here. The joint below it, so like the wrist and the joint above, need to be immobilized, so your newspaper should go above and below if possible. And then secure with some kind of tape or your gauze. So here's our friendly vet student. And we have dog fancy to make our splint. And so just fold it over once to make it a little bit sturdier. Oops. And then put it to the back side of the leg, and then they just tied it in place with some gauze strips. There again, this dog did not have a broken leg. It was also a volunteer. But should that be broken, that dog would have a muzzle on. And if it wasn't going to let you touch the leg, you don't attempt to do this at all, okay? But if it's unconscious and you see the leg kind of hanging at a funky angle, you can do that to try to keep a fracture that hasn't become open from becoming open. That would be the main reason for splinting, to make sure that bone stays in the skin and doesn't come out. But there again, it's not worth risking bites to yourself to get this done. Rear legs, the only thing you can really splint on a rear leg is going to be below their knee. Okay, same thing with newspaper magazines. Above the knee, really all you can do is immobilize them. Just try to keep them from moving around and get to the vet. And the most common one we see above the knee is going to be a broken femur because they got hit by a car. So those are some of the more common fractures. The good thing is there's so much muscle around there, it kind of keeps it in place a little bit. Okay, so let's say you have a splint or a bandage. Your dog came home with one, okay, or your cat. What you need to do, you need to keep them clean. Restrict activity. The biggest issue we have with these is they cause rubbing sores because they're moving so fast, or moving around. So you need to keep them as restricted. No like taking a jog with your dog or anything like that. If it's wet outside or snowy, you want to put like a plastic bag and make special booties for it to keep it dry, but when they come in, these need to come right off because otherwise they trap in moisture, which will be bad for the foot. And then you need to check the toes for swelling and then watch how you're using them. So I think the next slide is the gory pictures, okay? There we go. So these are ones that have gone bad. What happened is these bandages were left on. The people, too long, the people didn't check them. It caused severe rubbing. This is tendon that you see there. They rubbed sores that bad. That one basically sloughed all the tissue off the foot. So this is what can happen if we're not careful, or as a veterinarian, not telling owners what they need to watch for and how they need to take care of these bandages. So we want to avoid situations like that. All right, breathing problems. With breathing, we need to distinguish choking from respiratory distress. So with choking, these guys can't breathe in or out. Think of someone who has some food stuck in their mouth or a dog who has a bone stuck in there. So they can't inhale or exhale. With coughing, they can still inhale, they can exhale, they're just coughing with that. So if they're breathing and they're choking, you can see if there's a foreign body, just be careful you're not sticking it further down by pushing it down their throat. But a lot of these guys, you're going to have to get to the veterinarian to have them be sedated to pull that out. But if you have an unconscious animal, you may be able to sweep that out. So if they're not breathing, you can hang them upside down and say, do your finger sweeps. Do CPR if you need to. You can do a Heimlich on dogs and cats too. So a lot of times, if they are awake, you'll do them with them standing, or they can be lying on their back. So it's kind of the same position as on people. If you feel your rib cage, right at the end, you're going to put a fist, and then you're going to do the quick upward thrust. Also, on the AVMA, so the American Veterinary Medical Association, the recommendation is just you take the ribs and just compress together and give them, and if they're on their side, just do a sharp blow on the ribs and see if you can get it to dislodge that way. So here's a dog. What she would do, she's kind of got them upward, but she would just take her hands and try to do some thrusts that way with it away. On the side there again, you might just put a hand on either side of the rib and just squeeze, or if it's too big to squeeze, at least do some thumps on those ribs and try to get it to dislodge. Okay, respiratory distress. These guys get really freaked out because they can't breathe. Think how you would feel. So you need to check for foreign body fluid, for unconscious CPR. A lot of times our stubby-nosed dogs go into respiratory distress because they got overheated. So this happens a lot in the summers, and these are one of these, the weather's getting warmer, things we're going to see more of. So what you need to do, you need to try to get them cool, and you get them into a veterinarian right away. Because what happens is the harder they pant, the more swelling they get to the soft tissue in their throat, and it's just a vicious, vicious cycle. They have to get into an emergency center. Okay, thermal and electrical burns. So thermal burns, try to extinguish any flames safely if they're around, and just apply cool compresses. You're going to have to get them into a veterinarian at some point, but keep them. You can do a Telfa pad. You want something that's not going to stick to those burns. And the biggest concern is we get infection and dehydration. So electrical burns, first thing you need to do if the power's on is find out where that power source is and get it off, or you're going to suffer the same thing. You can try to move the pet away with a non-conductive material such as a wooden broom. Don't recommend anything metal, right? Okay. And hopefully it might be an adult doing this and not you guys. The CPR if needed, keep the pet warm. Tend to the burns. So where animals get burned a lot is their mouth. Anyone seen Christmas Vacation? What did the cat do to the lights on the tree? Chewed on them and it went poof, right? So but what they do is they get burns in their mouth. So that's where you'll see those a lot. But you need to get them into the vet, but secondarily, sometimes hours or a day or two later, we start getting fluid buildup in the lung and some heart issues. So don't ignore if they've been chewing and have electrical burns. You need to have them checked out. Okay, disembowelment. We got guts hanging out. When does that happen? We've done usually it's either from a really bad dog fight, or we've done surgery. We've spayed a female dog or done an abdominal exploratory, and so they have sutures there, and they jump off of something too high, too much pressure, and everything just breaks apart. This is a very big emergency. So here's where you want to get some towels, get them wet, and all you're going to do is try to cover things hanging out. Plastic wrap, like saran wrap, would come in handy just to bind that in place to keep it from drying out, and they need to go ASAP to the vet. Because what we don't want is intestinal loops and things getting dried out. So I know it's gross, but it can happen. And if you have an e-collar or you can make one out of a towel, put them on it. As gross as it is, they like to turn around and chew on things. So you have to be careful with that. Eye injuries, so eyes get bad really fast. So, you know, when people call and say, hey, my pet has a red eye, I'm like, yeah, don't wait till 2 days to bring it in. Let's see it sooner than later, because they do progress pretty quickly. Some things can wait, but you never know until you see them. That's the only thing you can do. Let's say maybe you're at the dog park, and then your dog came back in squinty. They could have some dirt or debris. So we have, even contact saline would work, but they make eye flush, they make eye washes, liquidy artificial tears. You can try to flush them out. Don't ever try to take a foreign body out yourself. You can cause a lot more trauma though. But the only thing you can really do is flush the eye, artificial tears, and then get them into a veterinarian. Okay, eye out of the socket. When do you think that happens? They pop out an eyeball. There's two common scenarios we usually see it. And these are usually your flat-faced animals again. They have eagle eyes with very shallow eye sockets, so it's easy for them to come out. When do you think that may happen?
Because they're applying pressure to the temples.
Okay, so, well, yeah, handling, we have to be careful when we handle these guys too. So, but pressure is somewhere to that area, right? So dog bites, usually we see this big dog bites a little dog right through there, or hit by cars. They get hit by a car, and then that's a common sequela. So it's gross, right? Again, you need to keep this moist. So whatever you can find, get it wet, cover the eye. If you have some Vaseline around or something like that, put that on there first and then cover it with something wet. E-collar, so they're not trying to pot that eye and cause more trauma. And then they need to go right away to a vet. But these are things you can still do to minimize how much harm is being done to them. Okay, overeating. Again, heat stroke is going to be coming up pretty soon here. So extreme panting, these guys are weak and they're restless. Their saliva starts getting like mine because I've been talking, just thick and ropey. So the dogs are out maybe having kind of thin drool when you first went out for your walk, all of a sudden they've got this thick slobber coming out. They're going to start looking sometimes really dark red. If they start going to the shop though, they might have that kind of muddy look to them again. Usually they start lagging behind, they might be stumbling. This is an emergency. So usually when we see this, either dogs get kept in the car with the windows cracked, right, not enough, or the owners are out running them at noon, something like that. So what do? Anything over 106 is going to start cooking the brain and isn't good, so we need to get it cooled off. If you're outside, move into shade or a cool room, spray cool water on them and then blow a fan on them if you can. So if you're outside and you have a hose, you can hose them down. You can put cold packs to the armpits, to the head, to the groin. You do not want to submerge them in really cold water or ice water. Same goes for people. You have any idea why we don't want to do that? Sounds like a good idea, right? We want to cool them off. And now it's the end of the day, it's taxing your brain. So what it does, it constricts their blood vessels. Well, when the blood vessels dilate, it's easier for heat to escape. When we put them in the ice bath, it constricts those blood vessels and actually it keeps trapping the heat in more. So we don't want to submerge them in icy water. You do want to watch their temperature though, because once you get them about 103, you don't want to keep cooling them off. You don't want to go the other way either. So you need to keep watching that. And these guys need emergency attention. Okay, the other reason they get overheated is they have infection or inflammation going on. So there again, over 106 can begin to be life-threatening for these guys. If they're over 105, you can wet them down with water, put a fan on them, there again, the cold packs again. Stop when the temperature gets down. You want to encourage them to drink cool water, if possible. Do not give aspirin, especially to cats. You can kill your cat with the aspirin. Basically, they need to get to the vet and you need to find out why they're in a fever. Okay, I'm sorry this isn't any clearer, but I thought this was kind of funny. So, hypothermia, all right. So that could be today though, right? Tomorrow we'll have hyper, it's supposed to be 60-some. Today we have hypo, this is 20-some. Okay, hypothermia. So these guys are usually body temperatures less than 99 degrees. They're shivering, they're really getting bad, they're stuporous, they're not responding to you well, they may even be comatose. So you need to get them in the warm area. Warm blankets. Be careful with your water bottles so that you don't get the water. There again, this is where your milk jugs and things come in handy. You can fill those up with warm water, but there again, you can burn the skin. Or if you're using like the rice bags that you put in the microwave, think about how hot some of those get. You need to wrap them in another towel so it's not directly against their skin. If you put them in warm water, what you have to be careful of is when you get them out, that they don't re-chill. Think about how cold you are when you step out of the shower in the winter. Okay? And then, so don't burn them. Be checking their temperature every 5 to 10 minutes. And really severe hypothermia, they're going to have to get into it. Okay, impalement injuries, they happen. So sometimes you have people out shooting animals, but more often sometimes you have a dog running through the woods and they run into a stick and they jam it into themselves. Or post-tornado, you have debris flying around, they make it to the animals. So don't ever try to take them out by yourself. If you can calm them down, do that. If possible, without moving it, if you can cut this down so it's not so long, so you don't have a big lever for them to get caught on, try to do that. This is where Vaseline and plastic wrap come in handy. So if you can put a layer of Vaseline around, let's say it's penetrating right here, put some Vaseline around it and then plastic wrap to seal it. Because what can happen, let's say that's this is important for a chest cavity. If this arrow is into the lung, it's allowing that opening, it's allowing air to keep coming into the chest. Well, the lungs are sitting in the chest, right? If you get air between the chest wall and your lungs, you get too much air, the lungs can't expand. And so we have a problem with that. So you want to wrap it around, only 3 sides only. You want a little bit for air to escape when they breathe out, though. So, but if you don't have that, that's okay. The main thing is keep them calm. You can cut it down short, and get them to a vet right away. Okay, near drowning, we have that a lot. People have pools, so either they're going out boating with the owner or there's a pool at the house, and the dogs slip in and can't get out. So a lot like people, hang them upside down. You want to head down, tap on their chest, tap on their back, see if they can get some of the water expelled. Make sure you're checking airway, breathing, cardiovascular, and if it's real severe, you need to get into a vet, okay? If you notice, a lot of these are like human first aid. If you've ever heard some things you do for people, a lot of the things are the same for animals. Nosebleeds, we do see them. So just like people, you can try an ice pack if they'll let you hold it on there. Animals aren't quite as compliant. Steady pressure, otherwise at least try to hold some pressure on there. Keep them calm. If you can, note if it's coming from both nostrils or just one. This is important, especially if it continues. Oops, because we can see nose bleeding for a lot of reasons. Sometimes there's a tooth, an upper tooth, that the tooth root is abscessed. And what that does, it goes right into the nose and causes bleeding. Sometimes we have tumors. And in Kansas, there's certain fungal infections that can cause that breathing. Foreign bodies that pulled a lot of grass out of noses before will cause that bleeding. Sometimes there's clotting disorders. Most common in the winter we're going to get, they eat rat poison. So sometimes we're going to see some bleeding from that. So try to know, if it's just one-sided only, usually means there's a foreign body or a bad tooth or something like that. If it's both sides, we worry about could there be a clotting problem with that animal. Okay, paralysis. This happens a lot, especially basset hounds, dachshunds. They blow a disc in their back and they become paralyzed, or an animal's hit by a car. Those are probably the most common ones you'll see. Try to keep them calm. If they're painful, you might need to muzzle them. This is where a backboard or a blanket or a coat, you don't want to just lift them up by the belly. They have an injury, especially like a dachshund or a basset here. Lifting up on the belly one makes it hurt more and could make it worse. So we want to be very careful. If it is because they were hit by a car, remember you may have to do CPR or things like that on them too. You need to see a vet with these guys. Poisons. So chemical poisons, try to call a poison control center if possible. And there's numbers and web addresses on the end of that with some of them. So one's going to be the ASPCA and the other's the Pet Poison Helpline. And so centers that are familiar with animal poisons are the best for you. Have a label of the product handy. So let's say it's your own pet. One question I'm going to ask you if I'm on the phone with you is, what's on the label? Can you tell me what it is? Because it's hard for us to give advice if we don't know what poison that we might be working with. And you want to always know, but if you can bring that label with you, that's very helpful. Because inappropriate treatment, in some cases, is worse than no treatment at all. So topical chemicals, these can be like flea products. So a lot of times a cat gets a dog flea product put on, and some of these dog flea products can be fatal for cats. So you need lots of flowing water, mild soap for these flea products, just baby shampoo, mild soap, dishwashing soap like Dawn, something like that you can use. Oily things, oil-based, definitely a dishwashing liquid. Sometimes they're dry chemicals. And put in a question mark by vacuum, because here's the problem. When you vacuum them, it aerosolizes it and you may inhale it. So you're better off by just brushing it off. You should wear something around your own mouth if you have to do that. And then don't just put them in a bathtub and try to get it off. It needs to be flowing water. Some chemicals are activated by water. So if you just put them in a standing, like let's say a wading pool or a tub full of water, nothing flowing, it activates the chemical, and they're sitting in a chemical, in a bath full of chemical that way. So make sure your water is flowing. So like a shower or a hose, you're getting it washed off of them. Okay, ingested chemicals. Here's when we don't try to induce vomiting. It's just like people. If it's a strong acid or alkali cleaning agent, something like kerosene, gasoline, you don't try to induce vomiting. If they're seizuring and unconscious, you can't make a vomit. It's not a good idea to have a vomit. If they ate a sharp or pointy object, it's not good having it try to come back up. If it didn't cut on the way down, it might cut on the way back up. If it's been greater than 3 hours, it's usually pointless to try to get them to vomit. Or, very important, you have the label that says don't induce vomiting, don't induce vomiting. Okay, but when do we induce vomiting? If it's been less than 3 hours, You just can't get in touch with the poison control center. You're not sure what to do. You can't think of any contraindications. Contraindications being all of these things, okay? So if you can't think of a reason, okay, it's under 3 hours, it's not sharp point, it's not gasoline, anything like that, then you might think about inducing vomiting. There again, sometimes we can make them worse by doing that. So how are we going to make them vomit? So you can use hydrogen peroxide. This is the regular, what you use to clean wounds, not what we use to bleach hair with. That's a stronger concentration. Get a mil per pound of body weight, and that's on there, up to a maximum of 45 mils. You can repeat it in 5 to 10 minutes if they haven't vomited. If this is something, let's say they got in the rat poison, that would be a big reason to induce vomiting, okay? So you can try to get them induced vomiting, but you still need to get on your way to the vet. Don't wait for the vomiting to start. Give them their hydrogen peroxide, get in the car, and get to the vet. And if they vomit with 1 dose, don't give them any more. More is not better. And then cats, unfortunately, hydrogen peroxide isn't a good choice for cats. It can cause what's called hemorrhagic gastritis, basically bleeding of the stomach lining. So in general, unless it's something severely life-threatening they ate, we want to avoid hydrogen peroxide with them. I will tell you, like syrup, but Ipecac that people use isn't very effective for animals usually. So what you want is just basic hydrogen peroxide at 3%. Plant poisons, try to identify the plant, induce vomiting and unconscious. Check your airway, breathing, cardiovascular, and seek veterinary care. So, and remove the offending plant. So if you have a poisonous plant that your cat or dog can get you in your house, you want to keep it out of reach or out of the house. And then some of these are outdoors too. So then sometimes things like spider plants that are non-poisonous just make them puke anyway. I will say, what do you think is one of the more common plant poisonings that we're seeing anymore? Especially, let's say, Colorado. What did they legalize recently? Oh, really? Marijuana. Come on. You guys have to be hip with social media. And so what happens is they're putting brownies and cookies and things, and guess what the dogs like to eat? The brownies or cookies. So I was talking, we had a candidate coming in to interview who works at Colorado State. So I did have to ask her this question because I just couldn't help myself. I said, are you seeing all the marshmallows? Oh yeah, we're seeing a lot of marijuana poisonings. She said, but the good thing is people fess up to it because it's legal. And so before we had to like beat it out of them. Could it be marijuana? Because no one wanted to tell you because it was illegal, right? And I just heard on the news they're discussing legalizing it in Kansas for medicinal purposes. But there again, pets get into it. Luckily, it's usually not life-threatening for pets, but it can make them pretty sick for a while. Hey, snake bites. We deal with a lot of snake bites safely. Don't pick it up if you think it's poisonous. I had it several years ago. A guy's dog got bit by a copperhead, and he went to pick up the copperhead so he could bring it in, and then he got bit. He ended up in the hospital. Okay, don't do that. So always seek veterinary attention. Keep them calm and quiet. You do want to keep them calm because it's circulating in their blood system, so we want to try to keep their blood pressure from going up. You might have to do CPR on them. You may not get this done. These guys are incredibly painful, so you very well may not get them washed. If possible, a lot of times they're been on the leg because they're pawing at them. It's either the face or the leg because they stick their nose or they paw at them. Try to keep them when you're transporting with that extremity a little lower than their heart. So these are 3 of the more common ones in Kansas. So we're going to have a copperhead, which we have a lot around Manhattan. And then you're going to have a cottonmouth, and then we have rattlesnakes that are around too. And this is what they look like. They get a big old schnoz, and then later they slough their tissue. Now, some of the rattlesnake bites more likely to have systemic effects too. Copperheads usually leave them looking like this. And so, but you want to be really careful. The venomous snakes usually have more of a triangular kind of head, where your non-venomous, like your garter snakes, have a more oval head. Not that you want to get that close and look at it. But like within minutes, these guys start swelling. Okay, so we're getting towards the end here. So you have these listed, and I update because from last year, they changed some of these numbers. These are their current fees. These are, you do have to pay a fee, but it's well worth it if it is a toxin. There's so many things out there. A veterinarian also cannot be well versed in every toxin out there. So even we have to call like the ASPCA and ask what are your recommendations. And so they do take their money with a credit card. Your only choice might be local poison control. Just remember they're not always well versed in animal medications. Although just yesterday reading in one of our online articles, the local poison controls are getting a lot more, kids are getting calls about kids eating the animals' medications. So there's a lot of that going on. So if you have pets at home, it's a good idea to have a first aid kit, have some resources like poisonous plant books, things like that. Be knowledgeable, keep calm, and then, or you'll look like a student with an e-collar, keep her from cheating her patient. Okay, I made it pretty much. I know it's a lot of flying through. Any questions at all? Some of you are going to have to do some of these things to your pets. So we see dogs getting cut all the time. You go hunting with your dog, they run through fences. Cats get bit all the time by the other cats. So they're going outdoors, or even with their buddy indoors. Sometimes they fight.
How many do you have dogs and cats?
All right. So,
everybody.
And if you're really thinking about you might want to be a veterinarian, you start looking, see what their gums look like. If it's nice enough for you. Lift up their gums, see what a normal color is. Start finding their heartbeat. See if you can find the pulse on the inside of their leg. So, because you might pick up on that they're sick. A lot of times people just don't realize their pets are sick because they don't know like that rapid breathing isn't normal, those kind of things.
So let's thank you. We've got a lot of really good information tonight, so hopefully you'll pick up handouts. There's lots of handouts back there to help yourself.
Is that Kelly Toole? She have any questions? She is continuing. Oh, she.
And so we hope that you'll come back to some of the future lectures as well. Next time we'll be on Fix and Bleeds, which is another time we see in the spring. So back. Thank you for being here. We really appreciate your time.
We do have someone joining us remotely, Kay Essler, or E. Kessler. It says, hello, KSU Olathe. Why is aspirin bad for cats?
Does anyone know? Aspirins are a little different than, or cats are a little different than dogs and people. They lack basically some of the enzymes needed to metabolize some of these drugs. And so aspirin can basically be lethal. It will kill cats. So there are some doses we use in cats. They're very low, and so you have to have it recommended by your veterinarian. And so there are some doses in aspirin. Tylenol, one pill can be toxic for a cat. It can cause some bad anemia for them. So ibuprofen, really bad for a cat, which is why we often have a saying, cats are not small dogs. There's a lot of drugs we can give dogs that we can't give to cats. Their metabolism, their physiology is just different than dogs. So part of being a veterinarian is you have to learn these differences for all these species too. Things we give to one animal, we may not be able to give to another animal. Have you heard of like Frontline that you put on your cats and dogs for fleas and ticks? We put that on a rabbit, we can kill a rabbit. So they can't use it, but both dogs and cats can use it. So there's a lot of things that are different that we have to know. So it's a hard profession. You got to learn a lot of stuff. You're not just learning about one species.
Next one says, how do you induce vomiting for cats? Since I guess hydrogen peroxide is not a good option for cats.
So typically what most people do, just have to get them in the vet, and there's some medications we can give them. Like I said, if it is a dire emergency, I would do the hydrogen peroxide, knowing there can be some risk with it. But usually there's an injectable medication we give them at the office to help vomiting with that.
And another one says, what do you do if your dog gets stung by a bee?
That's a good question.
In the mouth?
Yes, and they look like the dogs, so there's snake bites. That one actually, so long as they're not having breathing problems or they're not shocky, which most of them don't, they just come in because they have a big paw or usually a big nose because once again, they stuck it where the bee was. Benadryl. So we use a lot of Benadryl in dogs. And we can give it in cats too. So for bee stings, we do Benadryl.
And what's the first thing you should do if a dog has a seizure?
That's a good question. Okay, so if your dog is seizing, it's really, really scary. One thing you want to try to, if you've got a watch on, you can look at a clock, try to time it, and then notice what they're doing. So some of them will urinate and lose their bowels. Some are tremoring like that. Some are snapping their jaw and drooling. And so some are just kind of minor. They just kind of fall over and maybe do a little twitch. So it will help the veterinarian kind of knowing how long it lasted, and then how long after they recovered, they still act kind of goofy, how long that period lasted a little bit too. Now if they are by like a stair or something like that where they might roll and fall off, grab a leg and pull them off. Do not stick your hands in their mouth. They're not going to swallow their tongue, and you're going to get bit if you try that. So mostly you're going to time it. But if that seizure's not real, most seizures go away after 1 or 2 minutes. It seems like an eternity when you're watching them. They usually stop. They're getting to be 5 minutes. They have to get to a vet. There's nothing you're going to be able to do for them at home with that. So, but after the seizure's over, you'll want to call your vet and let them know what's going on with them. Is that the last one?
Unless there are other questions. Sometimes
And it gives
questions
you a long day, I
get
know.
other questions. Oh, there's one.
What's one of the more interesting cases you've come across?
Oh boy. Let's see. I'm trying to think of any recent. Just in the past 2 days, within 24 hours, we had 3 dogs come in, all with the same kind of similar red eye. The pupil was smaller in that eye, so their pupils weren't the same size. I won't say that's interesting, but we always joke that things come in threes. Well, our third one came in yesterday, and they all presented about the same. So, oh my gosh, it's hard to even know where to start. There's so many cool things that you can see. That's one neat thing about the profession, because you just think you've seen it all in something, like a dog with a lure in its mouth, you know, you get things like that. There's always, okay, veterinarians are always kind of gross with what we think is cool, but some of the tumors we see and things like that are kind of cool looking. The exotics people, they work on the tigers and stuff, so they get a look at those things. Oh, I don't even know where. I like a good abscess. I like to pop and get the pus out and flush them. So surgeries are fun, taking out some of the masses and things. I don't know. I like being a vet. I think it's all cool.
Do you have horses at home?
I do.
Okay. I was going to say, when you were talking about the prolapsed eyes, I've seen prolapsed eyes of horses.
Oh yeah, if they get kicked or something by another horse.
Kicked in
Yeah.
the face.
Yeah. So
Yeah, you see all kinds of interesting things. No day's the same, for sure.
no, it's not. No day is the same. There's always something different. So, or the things they vomit up, you just go, whoa. Or, and what's really cool, if you ever get online, you can probably Google these, just like interesting veterinary x-rays. Like there's always a contest of what veterinarians have the coolest x-rays of the year. Like dogs have eaten like 20 golf balls. Or there's one of the other ones, a pit bull, and ate a steak. They always look huge on x-rays, but swallowed an entire steak knife. And so, yeah, I mean, so the x-rays are pretty cool on some of those.
So any of you have dogs that eat socks? Our Corby loves socks. He doesn't so much anymore.
Yeah, we had to induce vomiting on Otto because he ate a sock. Because the problem with socks are they can obstruct them as they pass through the stomach, and they can obstruct their GI tract. So, oh my gosh, the things animals get obstructed with are quite amazing. So, or the diamond ring, well, the diamonds don't show up on x-rays, but the ring part will. So if you're trying to decide if your spouse gave you a real diamond or not, take an x-ray of it, because a real diamond won't show up, but glass will. Just not that I've tested these.
Well, again, thanks for coming. Thanks, Dr. Nelson, for being here.
All right.
Should be around for a few minutes if you have individual questions.